Okay. We're actually trying to talk about, we spoke about fundal height. So fundal height, we're now saying, is what could actually measure from the pubic symphysis right to wherever the head of the uterus is. Now, head of the uterus is what? The fundus. So we are saying from week 20, this fundus can be able to, if you measure it, use a tape, use a measuring tape. So what you measure, the centimeters you got, if it is 24 centimeters, the baby is 24 weeks old. If it is 26 centimeters, the baby is 26 weeks old. But this is a traditional method of trying to know how old a baby is. And it can have limitations. So you are now trying to look at the limitations. What can make fundal height and gestation age not to align? So you are looking at the limitations. You are looking at the disadvantages. Alright? So it's not always correct. For example now, a woman has only one baby. It's accurate. What if this woman has two babies? Will it be accurate? It will not. Okay? Because the stomach will get so big because, multiple gestations. So let's look at it. First, when fundal height doesn't match the gestation age, it can be a clue that something unusual is happening in pregnancy. Alright? So if fundal height, now look, fundal height could be more than the gestational age. The fundal height is 30 centimeters and the woman is only 24 weeks pregnant. Maybe the fundal height is what? 26 centimeters and the woman is 30 weeks pregnant. So it could be what? Smaller, it could be bigger. So what are the issues you are suspecting if it is smaller? If there's intrauterine growth restriction, so something is compressing the growth of the baby. Oligohydramnios, so the amniotic fluid is small. The baby is not dancing like they should. The amniotic fluid is like their swimming pool, so they are chilling, they are moving and all of that. Incorrect dating, it could be that there's just miscalculation. Fetal demise, it could be that the baby has died. Engagement of the fetal head, so if the baby is trying to come out, the stomach is reducing. Do you understand? So what are scenarios that the fundal height can be larger than expected? Macrosomia, if the baby is big. Polyhydramnios, if the amniotic fluid is too much. Multiple gestations, if you have twins and triplets, just like I was saying, it will be bigger than the one baby. Okay, so uterine fibroids and incorrect dating. So what's the next step? So fundal height is often more accurate by more than, you add 2 centimeters or plus, you add it or minus rather, so you can order an ultrasound. This was used in years back. Yes, it's a technique still taught to medical students because you have to acquire the skill, but after you have acquired the skill, you can dump it. Yes, you know what it means, but you better use ultrasound. It's better. So consider serial measurements, Doppler studies, monitor for signs of those complications. Do you understand? If at all you are having like a guesswork that those complications are coming up. So that's just it for reasons why fundal height may be more than or smaller than the gestational age of babies.